So between May 9th and 10th, we had 9 new cases who tested positive for COVID-19 here in British Columbia, and between yesterday and today, an additional 14 new people who've tested positive. So that brings our total to 23 new cases since we last reported on Saturday, and our total in the province is now at 2,353 people who have tested positive in British Columbia. That includes 873 people in the Vancouver Coastal Health Region, 1,118 in the Fraser Health Region, 125 people in the Vancouver Island Health Region, 180 people in the Interior Health Region, and 57 people in the Northern Health Region. We currently have 19 active outbreaks in long-term care, assisted living, or acute care, with an additional 8 cases in that area, bringing our total there to 291 residents who are affected and 184 staff. There are 19 long-term care facility outbreaks that have been declared over, and one of the units at Ridge Meadows has also resolved in the previous couple of days. We have no new community outbreaks, and on a very positive notes, the outbreak that we had in a number of temporary foreign workers who were at the Bylands Nursery in West Kelowna have now all recovered, and there are no new cases, and that outbreak is officially declared over as of today. So that is excellent news. We know how much we depend on the temporary foreign workers who come into British Columbia to support our agriculture sector, and that their health and the health of our communities is paramount. And I want to really give a note of thanks to Interior Health, who spent a lot of time supporting this outbreak, and also to the community in West Kelowna who stepped up to support the workers and the nursery through this very challenging time. And public health continues to provide support for the other community outbreaks that we are dealing with. And so in terms of case status, we have 634 active cases remaining in British Columbia right now, and of those, 66 people are in hospital, 18 of whom are in critical care or ICU. We've had 1 additional death to report in the last 2 days, bringing our total of people who have died from COVID-19 in BC to 130. And our hearts go out and our condolences to the families, the caregivers, and the communities of these people. We have 1,719 people who are now fully recovered from COVID-19. As everybody knows, to protect our province from this outbreak and to ensure that we didn't have rapid increase in cases in the province, we moved very quickly back in March, it seems a long time ago now, to put necessary orders and restrictions in place. And everybody in BC has been doing their part, and we are now in a much better place than we were a number of months ago. And as we look ahead to the restart of our province in the coming days, we want to move slowly and thoughtfully. Next week, if things continue to go the way that they have been going, and I fully expect they will, we'll be at the beginning of our phase 2 of our pandemic. But being patient and calm must be top of mind right now. Whether you as an individual, as a family unit, a business, you need to take the time you need to think about how you're going to adapt your activities to the new ways of operating in our province, to our new normal. I've heard from many who feel they'll be ready to go as soon as they're able to, and many others who want to take the time and look at their own individual circumstances. And that's okay. I think it is important for all of us to not feel rushed, to make sure that we're doing what's best for our families, our communities, our business. A steady stream will be far more successful than a rushing river that can damage things in its path. There are still new community cases that are unlinked that are arising every day, although they are smaller in number now, and that is also a very good thing. We also have a number of outbreaks that are continuing both in our long-term care, in some of our acute care facilities, and in the community. So this means COVID-19 has not gone away. It is still a risk to us in our communities, and we need to strike that right balance between the easing of restrictions to make sure that our forward approach is safe, practical, and sustainable in the long term. We do not want to have to go back, and the way that we're putting forward our restart plan is one that we hope will take us to that area, that sweet spot as we talk about, that will allow us to sustain this opening up over the coming months, regardless of what happens, that we're able to control the COVID-19 that we're seeing in our province. So when and if you reopen your business, do what is right for your business to protect yourself, your employees, and your customers. And be patient. That's my word for the day, patience. We urge everyone to show that kindness to your favorite store or to your favorite salon owner as they adapt their business and meet the new rules we have in place. Some businesses will take longer to open or may not open for many months because they feel it's not safe for them to do so. And we need to, all of us, be aware of our own unique circumstances that make it more or less risky for us to take this next step. And that's okay. Nobody should feel pressured. A thoughtful and measured approach will keep us all safe. We can, however, safely restart our province with everyone doing what we've been doing and working together. We must encourage and support each other with patience and with care. And we also must remember all of the important things that we still, all of us, need to do. That's including keeping that safe distance between us everywhere, whether we're outside, whether we're in a store, in a business, in our office. We also need to wash our hands regularly, cover our mouth when we cough, and very importantly, of course, is to stay away from others if we're feeling at all sick during this important transition time. And we must all, of course, continue to be calm, to be kind, and to be safe.